Thank you, thank you. This, well, we were yesterday. Let's go back to yesterday. What we could learn from the 4 networks that were presented, and have also been coming back during the 2 days. The ICH one, the PANDRA, the APEC, and the EAC. And what we can learn from it in conclusion is that there are actually many different approaches with different scopes. Some of them more on the, where we start from the last one with the EAC, starting from very, let me say, basic regulatory measures and standardizing and harmonizing between 5 countries or small groups of countries with trying to harmonize and standardize the work. That is their daily bread and butter, which in this particular case is specifically focusing on generic medicines and still very much learning. That's one of the younger networks. What we also learned from the thing was that what Lembit said was so many of these, and you could see it from these 4 networks, there are different processes. They are developing in the sort of independently, you can say, in different ways. ICH, of course, for a long time, other ones younger. Some of them I know in Africa even still not starting, although there is the political will to do it, but the sort of the technical activities have not yet started. And Lembit was sort of suggesting, well, we should have some good harmonization practice. And I think it makes sense to try to think now what are key success factors, and I think this meeting has already identified quite a number of them, and where to start, and what should be the sort of key thing. Another thing which I picked up from the discussions was be sure what you want to achieve. Be clear what you want, be clear why you want that. There was discussion about the business case this morning. I think there are many cost-effectiveness reasons. There are reasons to make it easy for the companies. There are definitely reasons that make it easier for the participating organizations. So be clear what you want to achieve and why you want to do that. Another point that came out is that if you really want to proceed, I think a good secretariat is important. To have, there should be dedicated people in a dedicated secretariat if you really want to be serious about harmonization. And it probably also means that in the participating agencies you should have dedicated people. What Lembit was saying, you can't speak to an empty chair. And I think we should realize that for many, especially for the smaller agencies, what it's now is it's just extra work. Harmonization is extra work. It's not yet replacing anything. So it comes on top of it. So then either people have not much time for it, or you really have they have to dedicate the time to it. So that comes to the next point. I think that harmonization needs resources. Financial resources to travel up and down to meetings, political resources, political support, and the human and secretarial support to do it. Now, so that leads me to the sort of conclusion. Harmonization comes at a price. It is really an investment. And I think even the savings may not come immediately. Still, if you would be sort of thinking, well, what is now more cost effective? All the agencies doing the thing on their own in a different way, or really harmonizing and standardizing and networking and using information available somewhere else. Of course, you can still, by intuition, already conclude that if you combine and prevent overlap and prevent repetition, it's going to be cheaper for everybody. But it doesn't take away the point that harmonization, it costs money. I think, and you can also say it's actually costly. But I would say it's probably also cost effective. And you can say, well, a small agency pretending now to do everything they do, and in reality, of course, not being able to do it properly. If they would now start investing in harmonization, they really invest in improving their capacity and in improving their performance. And I think that's the key point. So it has to be a political decision with a secretariat, with dedicated money and the dedicated will to really invest in improving the whole functions of the system. I would like to stop here, but I think these were the key points that we could take out from the very first session yesterday morning. Thank you.
Next we have Andreas Seider, who is just as a reminder, the Senior Health Specialist for Pharmaceuticals, Health, Nutrition, and Population at the World Bank.